You see, those ones are sexual, like gonorrhea, candida, which other one? Herpes,
and syphilis.
And syphilis. They are urinary tract infection, UTI, and they are sexual transmitted infections.
Yes.
Those ones cannot just come without you meeting a woman that is infected.
Exactly.
Those ones are separate from the prostate issue.
It's good to know. So if anyone wants to avoid UTI, although it's not the subject here, you have to don't play outside. Just manage what you have inside.
You use your ABCD. You know, like they
call
it
ABCD.
ABCD. You know, that's you abstain or be faithful or use a condom or whatever.
No, it's good we're having this conversation. So you know, to warn people, you know.
Okay.
Yeah.
Having discussed the prostatitis, which is the bacterial infection of the prostate, we now go to the benign prostate hyperplasia.
Okay.
What is benign? When you hear benign, means it is not cancerous. At that stage, you won't say that you have cancer, prostate cancer. It is not. But just because the prostate wall has enlarged from the normal side to the bigger size of it, meaning that it will not affect you when you want to pee. You start stressing. You know, you start feeling your bladder is full, but you want to pee, but you are finding it hard to pee. That stage is because of the cell wall of the prostate has enlarged more than normal. I will show show you the clip of how it is. And at that stage, you won't say that it is that this person have to a layman who doesn't know. Once you go to the toilet and you start staying 5 minutes, you have not peed, and people that are around you have finished peeing, and you are using your head to think, let this man finish and go out. So that only you will be in the toilet. And so I think I can know that at that stage, your prostate wall has started enlarging, making the urine not to come out the way it's supposed to come out, because we are now stretching the muscle wall to push the urine out.
Yeah, the prostate gland enlarges, then now compress, kind of like compresses the urethra, kind of like slowing down or trying to hinder the flow of urine from the bladder. And guess that's the
when
way
you are talking of this
explain.
enlargement, I know we would look at the other part of it. Is what could make it to enlarge? Is it that increase in portion of food, or maybe drinking 2 cartons of Star every weekend, or what could make it expand?
Partly our lifestyle contributes to this.
Like drinking,
even the what you eat as well.
Exactly.
Contribute to this.
Exactly.
You see, too much of pepper. What do we call pepper? Chili.
Yeah.
Chili
affects prostate. Too much of red meat affects prostate.
Red meat, yeah.
Sedentary lifestyle affects prostate.
What do you mean by sedentary lifestyle?
Not doing anything, not engaging in exercise, just
sitting down all
day,
doing anything.
Those that sit down for more than 8 hours in an office or without working out affect prostate. Mostly drivers who are doing this long lorry driver that sit so many hours on their seat driving long, it affects the prostate. So a lot of things affect prostate. Age as well affects prostate. Mm-hmm. Obesity affects prostate. A lot of encumbrances affect your prostate. So you need to live life in a moderate way. Okay? And at that stage, when it is benign, how do you know it is benign? That one question will be, how do you know it's benign? It is through histological examination, where your biopsy, they will do a biopsy test, meaning that they will pass through your anus and get some specimen to go and test if it's cancerous, if it's malignant. When it's malignant, it's cancerous. But if it comes out benign, then you know it is not cancerous. But that means it's an hyperplasia situation whereby the size has started enlarging based on certain lifestyle that person is living. Okay?
Sorry, not to interrupt him. Just the word hyper means high. In the biological term, plasia is the cell. You understand? So whenever I say prostate hyperplasia, like that hyper means high.
High.
If you say hypo means low. You understand? Yeah. So hyper means high. That plasia is talking about the cell increment. So probably enlargement of the prostate. That's benign prostate hyperplasia. Right? Any medical person or any biological scientist will understand that hyperplasia means enlargement of the cell related to the prostate. So that's just what I want to say.
Good. So what is the next stage?
Still on that benign prostate hyperplasia, there are other things that is involved. For your testicular androgens, your testosterone will produce a lead deck in the testis. Testis is like your penis.
Doc, try to explain it in a layman language so that some of us that are not scientists and specialists can understand some of this.
It's all centers on the lifestyle and the hormones that triggers the sizes to start increasing. Okay, so based on that, it's still not cancerous, so to say. Okay, but just that the fact that it's getting bigger in your cyst from the normal position to being bigger is affecting you. And how do you affect you? You start feeling uncomfortable with always going to pee. Always feeling after you finish peeing that there are still leftover in your bladder. Okay? Then the next stage is the main prostate itself, which is the cancer stage of it.
The main subject.
Yeah. But before I go to the cancer stage of it, the clinical symptoms of benign.
Okay.
The clinical, the signs, if you like, you call it the signs or the symptoms. What is the clinical symptoms? How do you even know that this is not cancer, but something is wrong in my bladder, in my prostate? The first is that you have what we call acute and chronic urinary retention. Meaning you finish peeing, but there's still a lot of urine at the bladder, at the kidney, not pushing out everything. Once their bladder is affected, it affects your kidney. Meaning that it's like here, the kidney is at the two back of, and the bladder, all of them are within the same interconnected. So once the prostate is affected, it will knock at the bladder. The bladder will trigger the urethra, and the urethra, it will now knock at your kidney. You start feeling uncomfy. Most especially, there will be a blockage. Sometimes what we call urinary stricture. You want to pee, but you're not peeing. These ones may occur within the age of when you're getting elderly. Prostate is majorly elderly issue. But we are asked to say from the age of 40, 45, 50, start going to check your prostate. How do you even go to check your prostate? Go to your GP now. If you have reached 45 years, here they may tell you it's 50 years, but as an African person, if you have reached 45 years, go to your GP and say, please, I want to do PSA test. They will ask you, why do you want to come and do the PSA test? You said, well, my age, I want to do it just to be on top of. You have the right to demand what you want. So the acute and the chronic urinary retention is part of the benign stage of that. Then you come to frequent urinary tract infection. Due to that reflux of urine in your bladder, urine can cause infection of its own because it's not pushing out.
Exactly.
It will not cause its own infection within the bladder and natural urinary enuresis. Meaning that in the night, you will keep using toilets more than 8-9 times before daybreak.